PTSD is beyond basic trauma. It can be triggered by major traumatic events like accidents, assault, war, or loss, but the way we see it manifest most is slowly and silently, especially in people dealing with chronic unresolved pain. Hello, everyone, and welcome to our TSI 10-minute training. I'm Dr. Vanbergen, Doctor of Natural Medicine and Certified Hash-8 Protocol Specialist. Today, we're diving into a powerful and often overlooked approach to healing. And this is using microcurrent therapy, specifically trigeminal nerve stimulation, to treat PTSD and to resolve PTSD in your patient base. Now, post-traumatic stress disorder is more than just a mental or emotional issue. It is a full body condition. It affects the brain, the nervous system, even the physical structure of the body comes under attack. And in many cases, chronic pain is either a cause of PTSD, a symptom of it, or both. In this training, we're going to talk about how PTSD manifests, especially in chronic pain patients, which is where you're going to likely see it the most in your practice as a certified pain resolution specialist, why the trigeminal nerve is such a powerful target for treatment, and how microcurrent therapy helps to rewire the trauma response. Now, PTSD is beyond basic trauma. It can be triggered by major traumatic events like accidents, assault, war, or loss, but the way we see it manifest most is slowly and silently, especially in people dealing with chronic unresolved pain. When the body is constantly under stress, it sends danger signals to the brain. This leads to hypervigilance, to nightmares and flashbacks, to emotional numbness or crazy outbursts, to sleep disturbances, and to a consistent, constant fight or flight state. Now, for chronic pain sufferers, these symptoms can be amplified because their trauma is ongoing. Their pain is the trauma, and it has not yet gone away. And traditional solutions like medications or just even basic therapy try to address PTSD, a very valuable tool. These fail to address the physical and neurological root of the problem. So why? Why is the trigeminal nerve, specifically up here on the forehead, the way to work through this? And how does this work for your patients? Now, trigeminal nerve stimulation, otherwise known as TNS, you heard VNS for vagus nerve before, this is incredibly powerful here. The trigeminal nerve is one of the largest cranial nerves. It connects directly to areas of the brain that regulate mood, stress, and fear. This is why when we're doing 3 pathways and we do the 6 points of the trigeminal nerve, if that's the issue, we know that it is an emotional problem that is bigger than the physical. So for trigeminal nerve stimulation, we're also being able to connect to the amygdala, the prefrontal cortex, and different parts of the brain as well that are important in processing these mood-based reactions. Now, when we apply our microcurrent stimulation to this nerve, we're not just relaxing the muscles or reducing pain, we're actively communicating with the brain, and we're helping it reprogram its trauma response. Now, there is science behind this, so let's discuss, possibly for the first time ever on a video like this, where this happens. How does this work? How does stimulating the trigeminal nerve impact PTSD? So first off, it reduces amygdala overactivity. Now, PTSD patients, so any brain that is affected by PTSD, shows high activity in the amygdala. This is the fear center of the brain. Now, the trigeminal nerve stimulation calms this area down. It reduces anxiety, it reduces flashbacks, and it reduces emotional overreactivity. The next thing it does is it helps to restore autonomic nervous system balance. PTSD keeps people stuck in fight or flight. And while we typically look to vagus nerve to activate the parasympathetic state, trigeminal nerve stimulation also does this too, and it can help the body shift into a rest and digest state where healing can begin. It also boosts neuroplasticity. This is the brain's ability to change. Microcurrent enhances the brain's ability to form new, healthy neural pathways, which are absolutely crucial for breaking trauma loops and building resilience. And it improves sleep and mood. Studies have shown numerous times that trigeminal nerve stimulation improves sleep and reduces depression and anxiety and enhances overall emotional regulation. All of these things are key to recovering from PTSD. Now, it's also important to remember that chronic pain is traumatic. The brain doesn't distinguish between emotional trauma and physical trauma that much at all. They both trigger the exact same stress pathways. Many patients we see at Pain Free for Life are dealing with pain that causes anxiety and depression, emotional trauma that amplifies pain sensitivity, and nervous system overload that prevents healing. So it's crucial that we look at patients and consider that almost anyone that has been in a chronic pain state for any amount of significant time at all is likely going to have a form of PTSD. And by treating the trigeminal nerve, we are addressing both physical and emotional wounds simultaneously, which is where the true healing begins. So the way we want to get started here is we need a device with gamma. This is 32 to 45 hertz. This means your evolution or your pinnacle are going to be required to be able to do this protocol. We unfortunately can't do it with the other devices. So what you're going to do here is you're going to set your device to 32 to 45 hertz. And you can place the trigeminal nerve pads on your patient's forehead here. But quite frankly, it also works fairly well just to place the Y probe in the center of the forehead on the third eye. There's also a third eye pad if you prefer the hands-off approach. Either one of the best options is to get the client to hold this, to lie down, and to close their eyes. And you're going to set the power to a comfortable level on that 32 to 45 hertz. You ideally want to be treating them daily, but I realize that in clinic, that is unrealistic. But 20 to 30 minutes of time to really stimulate that nerve is going to be the best option for you. If you can only see them weekly, just make sure it's a consistent pattern. Typically, there is a best time for this. A morning or early evening protocol is going to be best because this will help more with mood regulation throughout the day and sleep support in the evening. So if you're scheduling PTSD treatments with trigeminal stimulation, try and do it in the morning for clients so it benefits them through the day, or at the end of the day when it's going to benefit them through the night. Most patients will begin to notice improvements in sleep, anxiety, and emotional clarity within just a few sessions of this as well. And really with long-term lasting results developing over weeks as the brain begins to heal from the process of the trigeminal nerve stimulation. Now, I think I want to close with this, because that's the protocol. PTSD may seem like a life sentence for many people. And I think that the important thing here is that with the right tools, the nervous system can be rewired and restored. Specifically, this trigeminal nerve stimulation offers a very safe, effective, and empowering path forward for our patients and for us to be able to help our patients. For people suffering from trauma, from chronic pain, or both, this is more than a treatment. This becomes a true lifeline as a way out. And while it may not have those immediate impact effects that people are looking for in a treatment, if you can start these protocols, you will be changing patients' lives. So thank you everyone for joining me today for today's 10-minute training. Hopefully you found this useful. You rewatch this to your heart's content. Now, join me next week. We'll continue to explore the future of medicine, which is microcurrent and holistic healing, full body healing together with you. So thank you again. Take care. Bye-bye.